So you've had a recent injury to your back and it's causing you a lot of pain. What do you use? Ice or heat? So most recent injuries that present us in practice have an inflammatory component, which basically means that there's a lot of swelling in and around the joint, muscle, nerve or area. So step one is to get the inflammation under control. So protect, rest, ice, compress and elevate the joint or the area. However, what's hugely common in practice is to meet a patient who says, look, my wrist is swollen, so I have pain, okay? And that's fine. You can apply the Price or the Rice principles, no problem. However, if it's in your back, you usually can't see the pain or the swelling that's going on. So a lot of patients are coming in putting heat on the area. Please don't put heat on an acute or really painful area that's recently been injured, okay? It'll make it much worse. Okay, so what ice can you use at home? Okay, we're talking about acute inflammatory pain. So we've already said that we're not going to use any type of heat, okay? So that goes there. Two main types of ice that you can put on yourself, okay? First is a standard ice pack, okay? Now these go in the freezer to freeze and they retain a little bit of flexibility so they can mold around the joint or the back or the area that you're going to put it on. Now, if you put this directly on your skin when it's frosty, it's a really good way to get frostbites. Don't do that. Okay, take this. Pillowcase is pretty thin. Okay, you want to fold it over maybe twice. Just a standard pillowcase or 1 or 2 sheets of kitchen roll. Pop it in there and that's how you use an ice pack, okay? The other option is these ice bags, okay? They're really, really handy, okay? Unscrew the top, 10 to 15 ice cubes in there, half fill with water, compress it down, just like a hot water bottle, seal, and then we got a nice, easy, flexible ice pack, okay? Ice packs are brilliant because this acts like the pillowcase to the kitchen towel. It is your barrier layer, so you can put that directly on your skin. This, don't ever put that directly on your skin, okay? Ice packs can go in these kind of neoprene wraps, and that's really good for extremities, okay, as well. Every 10 to 15 minutes that you do this, you want to take an hour in between the next icing session, okay? So in acute injury, you want to always ice from the moment it started all the way up until about 5 to 7 days post-injury, especially for back pain, because people injure back pain over and over and over in the next week after the injury. Okay, so that wraps up the icing tutorial. If you found the video helpful, please like and subscribe. If you've got any questions, please leave them in the comment section below. If you'd like any other topic covered on video, write it in the comments. Is that good?